I'm Professor Nancy Doubleday at McMaster University, and I have the privilege of having the Hope Chair in Peace and Health here. And the work that we're doing in the course is oriented towards peace and health praxis. And so we have an action learning, action research focus to begin with. Now, the Wikipedia project is really interesting. Wikipedia has finally come to Canada. They've been working in the US, obviously, for a long time with their universities. They've had overwhelming success there. They're also working around the world. So we're part of the first wave in Canada, participating with Wikipedia's educational arm to generate content for Wikipedia. And so the students who actually did the work, because this is their project, this is not my project, are the pioneers.
We did mental health on refugee children. It was a passion of mine to research about children because I know as a career I want to be working with children, and refugee children was a topic I never really knew much about.
I mainly focused on pre-migration factors and the definition of a refugee. And although the topic itself was very, very interesting and has a lot of practical social implications, of course, what I liked most about the assignment was the fact that we were reaching a larger audience.
Liked the fact that Wikipedia was a place where we could put our information out there, and anybody could edit, anybody could contribute, and anybody could benefit from it. You know, a lot of our assignments get kind of stowed away in boxes when we're done, and this one really has a meaning and a bigger impact outside of our own little circle and our own little sphere.
Because I'm more used to essays where you take an argumentative stance, whereas with Wikipedia it was nice to be able to open up and research all different aspects of refugee children and to put it all into one database.
And so the students are actively engaged in determining their learning goals and deciding who is going to do what and how the pieces will fit together, and at the end of the day, what it will look like. The students themselves did the work.
Prospective mental health of refugee is a really, really important topic to understand, and knowing about the barriers to access and everything, I think has a lot of implications for future research and future practice. So.
As opposed to typical assignments where you write an essay, you take a stance, you prove a point, you receive a grade, and then that paper gets tossed away. Not necessarily, but you know, the throwaway assignment type of concept. This assignment will continue contributing to academia long after I receive that grade. So it's applicable, practical, and very useful.
And when I look at the faces, I know there's success. And there's success because it's there. It's a validation that comes from doing. It's akin to what Bandura calls self-efficacy, and so it's a form of generating that sense of not only that change is possible and we can all continue to learn and we can all continue to innovate, but it's evidence that that's true.